First, I want to thank the organizing committee and Professor Yaqub to allow me and give me the chance to represent the Aswan Health Center Prime PCI program. So, with no doubt that coronary artery disease is the leading cause of death worldwide, and data from Egypt show that patients with coronary artery disease usually directed toward the conservative strategy, and just 40% receive fibrinolysis, and less than 10% go to primary PCI. Currently, primary PCI is the more favorable and superior strategy for reperfusion over than fibrinolysis, and that in terms of death, short-term reinfarction, stroke, and combined endpoints. Data from Stand for Life from Egypt show that instead of the growing number of population in Egypt, still we lack sufficient number of cath labs that can do primary PCI 24/7 days. And here the situation in Upper Egypt, where Aswan situated, in spite of 20% of the population situated in Upper Egypt, they still lack and suffering from the same problem. No cath lab and no good medical service to satisfy their requirement. Aswan, this beautiful city, which is located in south of Egypt with the extremely beautiful Nile and very kind people. In 2011, the estimated Aswanian population achieved 1.3 million inhabitants. 40% of them are living in the urban area. Aswan governorate is divided into 5 regions with many cities and a lot of small and major villages. In spite some improvements in some health sectors in Aswan and Upper Egypt, however, patients with acute MI is still suffering and not taking their chance and facing a lot of challenges. The continuous growing population, the low socioeconomic status, as Aswanian people are so poor with low economic status and low education and long time of ignorance, and lack of awareness about ischemic heart disease, the symptoms, how to prevent, and how to react promptly when the patient is suffering chest pain. The increased prevalence of coronary disease all over Egypt, with estimated that 40% coronary disease is responsible for 40% of all cause of death in Egypt, and this promoted by the increased prevalence of conventional risk factors. 27% of the Egyptian population are hypertensive, and 11.6% are diabetic. In addition to so limited resources for the healthcare service. Why this? Hospitals, they are few in number, lack of equipment, understaffed, with poor infrastructure. People who are away from the Aswan city could suffer from transportation to the Aswan city due to unprepared roads. And some of the people are living in small villages and in an isolated island. Sorry. In addition, this inadequate emergency service and ambulance service, the poorly developed clinical network and referral systems, more obvious in Aswan, in addition to no cath lab for providing an emergency service. The healthcare service in Aswan can satisfy the requirements of the population. In spite many hospitals and ambulance, more than 100, they still lack of good equipments and resuscitation measures and well-trained staff on board. So, as Magdi Yaoub Foundation committed to provide the excellent service for Upper Egypt and state-of-art medicine and facility, Aswan Heart Center started to initiate the primary angioplasty service in Aswan. At the beginning, we focused on management protocols, strategies, policies, and discussed all these strategies thoroughly, internally, and externally with experts. Our aim was to put a critical pathway that provide good and sufficient medical service based on the guidelines that provide good medical outcome and improve the health status in Aswan. We provide the primary PCI service to we aim to cover the whole governorate and cover a distance up to 100 kilometers from Aswan city. And the Aswan governorate was divided in certain zones, and we start to provide the service within Aswan city and receive patients from 3 referral hospitals, which is Aswan Teaching Hospital, the Germania Hospital, which 1.5 kilometers from the center, and Aswan Insurance Hospital. And this by performing a tight and well-organized network and protocol with them. We contact the local health authorities, the Ministry of Health, Insurance, and some private hospitals, physicians, that to create more chance for patient referral and to help us in the community awareness. And we joined the Center for Life project. Our target was to create a rapid communication and activation between the non-PCI hospitals and the center, and achieve a rapid transport of patients with acute MI to Aswan Heart Center by any means, EMS, car, private, or taxi. Why? Because it's difficult in Aswan. Sometimes it's a dream to have a well-equipped ambulance with a well-trained paramedics or doctor on board. But in reality, many trials show that there's low risk of malignant arrhythmia and death during transfer. Then we direct our target to direct admission of patient to the cath lab, and then refer the patients back to the non-PCI hospital once they are stable post-procedure. Then our next step was to put a single telephone number, which is available 24 hours with an authorized emergency doctor, to activate the system and the cath lab team. And we provide the service at the beginning to be during the regular cath lab operating hours, and in the near future, we'll shift to a 24/7 days. There's a day primary PCI operator schedule with coordination between the cardiologist, senior cardiologist in the center, and our aim to provide the cath lab team to be ready within 30 minutes from activation. We definitely put a defined protocol for treatment of PCI patients and for direct admission to the cath lab, and unique protocol for the medication and procedures, and ensure safety procedures during transplantation, and do a lot of work in training of nursing and technicians. So we shift in addition to do an orientations for the physician from the Aswan hospitals, in addition to education program for staff in Aswan Heart Center, and including the doctors, cath lab, and CCU, nurses, and the technicians in addition. And there was many lectures, each is 30 minutes, guideline-based, clinically oriented, and for sure applied for Aswan Heart Center and Aswan situation. For example, the message to the doctors too, 2A and 2M, the target assessment for the patient, and to activate the system by the call, and to give the patient the most necessary medication, and to monitor him, transfer him safe to Aswan Heart Center. Finally, we put all the data in the digitally database system of the center, and all studies were stored in DVDs and CDs for research and education purposes. And this was done usually by the cardiology fellow under supervision of the attendant physicians. For quality insurance, all strategies and protocols were discussed thoroughly internally during our regular meeting with our colleagues in different departments in Aswan Heart Center auditing meeting. In addition to Professor David Antoniucci from Khariji Hospital during his regular visit to Aswan Heart Center, and this opportunity to thank him a lot for his support and help, and to improve our skills and our learning curve. Currently, our objective is to audit all strategies and test the policies and the performance standards to ensure that we achieve our target timing objectives, which is called the team within less than 30 minutes, the lab staff fully operating within 60 minutes, door-to-balloon time less than 90 minutes. Regarding the inter-hospital transfer system, our aim is to make door and door out from the nearby hospitals to be 30 minutes, and the total door-to-balloon less than 2 hours. We're auditing the patient journey from the admission, either directly to cath lab or to the CCU, and test all the procedures and our lab and the capabilities and standby within the cath lab, and the journey back to the CCU. During our auditing, we usually define the cause of the delay with long door-to-balloon time, and we have several discussions with our colleagues from the referral hospitals about certain numbers of patients that they refer, and definitely, finally, we define the patient's outcome analysis for our complications. And for sure, the data entry, put the patient, all data in the data entry base, the database entry. So, a lot of challenges and dreams, but we are moving forward. Currently, our aim to establish a network covering the whole Aswan government, and to activate the cath lab for 24 hours, 7 days, audit all the strategies and policies and our performance, and ensure proper data entry. What is important is the continuous medical education for ourselves, the physicians, the nurses, the technicians, and the cath lab staff. And I think we have a lot, in the future, we have sufficient data to work it and to provide us with our research activities and publications. So finally, I want to thank the whole Aswan Heart Center team, and especially the cath lab team and technicians and nurses, and our colleagues, my colleagues in the department, for their motivation, for their continuous effort, and the team spirit to continue this work and make it perfect. Thank you for your attention.
Thank you. Thank you, Dr. Amr. I think it It's a proud President for Life project to join Aswan Center. But I'd like to ask you some numbers about the Aswan itself. How many living in Aswan? How many living outside Aswan? How many doctors inside the hospitals? To have a relationship between the number of the doctors, the number of the patients, number of the...
Yes.
Do you have it? This?
I have it to the side, but...
but how many doctors, how many... can you bring back the
sure.
Komombo and the...
Yes, sure.
How many population inside Aswan itself?
I have no experience.
Come? 2 million. And you have 2 hospitals.
And there's two general hospitals.
2 general.
And up to 10 private hospitals with different specialty.
And you'll bring 3 ambulance cars to join, or 2 ambulance cars to join 100 kilos, you said?
No, still we...
This is responsibility of the government?
The government.
The government. So you share with the government to have this ambulance?
Yes,
okay.
I Prof talked with him, and I think there's some donations that provide us with an ambulance. So it's five districts, and from north to south is Edfu and Komombo. I have not the exact number, but all is 1.3
okay.
million.
As Dr. Amr has just shown, the program is in the formative stage, so it is still hasn't started. Although the team has performed successfully primary PCI, and the door to balloon was less than 30 minutes. So it is possible. So it is a feasibility stage. With regard to the ambulance, we fully intend to help the government, although they have promised and they have 3 ambulances, but there is an offer of 1 ambulance from the government which we can equip, but we are hoping to have a dedicated ambulance fully equipped in the center, which will help in this network. And as Dr. Amr was saying, this is we're going to be fully audited about how we can reach every corner in the government. And hopefully this program is scheduled for 2013. There has been a lot of effort and preparation and thinking, and now the time for action has arrived. And as Amr said, it's to join the Stand for Life. We have the program of 24/7 immediately there this year. The staff are now highly skilled. You haven't shown the number of cases which have gone through the training of and having skilled people around has been achieved. So we're ready for the next stage.
Congratulations.
Numbers, and currently there are 2 full-time consultants in Aswan and a part-time consultant interventional cardiologist. And we're performing around 12 to 1,300 elective procedures, ranging from coronary interventions to structural heart disease. So that gives you an idea about the volume of patients and the staff there. 2 catheter labs. The 1,300 cases are almost
Your time
60,
is
40.
Did you ask the ambulance before how much the ambulance car can move in Aswan? I mean, Because I think I thought that it is easy in
Yes,
Aswan.
yes, this is the advantage
It's
of
not
Aswan city.
difficult,
It's the road is it's okay, and the distance between the referral hospitals and Aswan center, even if the patients are aware enough, I think it's easy to provide this service.
So your problem is different from the Cairo,
Yes,
for example.
definitely.
The problem that now you need more ambulance cars,
Yes.
more education of the patients,
Awareness, yes.
and awareness of the referral doctors.
Yeah.
And send
we
them
did,
back.
It's
not the Aswan Heart Center itself. It's not because you're already well prepared before Stand for Life, and you have already you have already finance. You can make it like this, which is free. It's free for the patients. So you don't have this problem. So concentrate on the problem. The problem with the government, increase the number. If they don't have, please bring more ambulance cars to them. And then you go to the governments through us for Stand for Life for the poor patients to come to you. I know that you can treat the poor patient, but we can help you on this. The third, that already the doctors surrounding you, we can help you in guideline implantations according to Act Now Save Life.
We did a lot of lectures and orientation sessions for them, and I think
with you.
It will.
And I mean with you. I mean we can speak one language.
Yes, that's right.
One language. This is belonging to the Act Now Save Life, which you advise the European Society of Cardiology. Yes. I know that you know the guidelines, but I mean should be one language upgraded according to their advice for preparation of the patient. Yeah. And congratulations.
Thank you very much.